Lovely to be here, and I'm really passionate about sharing opportunities with you and answering any questions that you might have. So yeah, I'm Sharon Blaney. I work for the Liverpool City region, and I'm a project officer. Now, basically, I only work with the NHS and the healthcare sector. And what my role involves is actually helping young people to access opportunities within the NHS and the sector. So essentially, what I want to do is to make that opportunity accessible for you and to help you with that. So what I wanted to do is share some information with you, and I'll leave the slides with Rich at Thrive. So if you've got any questions, you can actually revisit them. Okay. So the first thing I wanted to share with you is, okay, why do we need young people in the NHS and social care? Well, you can see from the information there, we do need you. We did this survey across Cheshire and Merseyside, and we found that in the sector, there was only 4.9% of the workforce are 25 and under. Now that really shocked me. And then when you look underneath there, 57.5% of the workforce are 40 and over. Now that's classed as an ageing workforce. So if we don't have a pipeline of young people to train, to skill, to support, what are we going to do in the care sector? Also, looking at the average age of an adult social care worker, it's 43 as well. So essentially, we really do need to be looking at young people coming through and supporting. Now, when you look at the other side of things, youth unemployment is rising. So there's a massive imbalance there. If youth unemployment is rising and we haven't got enough young people in the sector, then really what we need to be doing is letting you know what the opportunities are. I'm not saying everybody wants to work in the sector. I appreciate that. But if you don't understand the opportunities that are there and something might just be right for you, then essentially, this is why I want to share the information with you so we can get more people interested. There's always vacancies. There is a high turnover of staff, and usually that's because people's circumstances, you know, their home life, it changes so they can't do certain shifts, or different reasons for that. Or they could just be in the sector and not really have matched themselves to the right role. Who knows? So there's lots of attrition rates of people who are leaving, who've done a year in training and then decide it's not for them, and I wonder why that is. So we're looking into that. We have got a reduced supply pipeline, which is you, so we need to work on that and help you, in essence helping each other. There's so many attractive careers in the NHS, and this is what I want to share with you. The NHS is like a TARDIS. For those of you, I'm not really a Doctor Who fan, but I just thought this was a good visual to share. The NHS is like a TARDIS. There's so much more inside than you can imagine, and it could take you beyond your career dreams into a world of opportunities. Basically, the NHS, they're actually classed as a destination employer, and what that means is once you join them, you could literally progress and have a career ongoing for the rest of your life. Okay. So 350 roles there are in the NHS. Who'd have thought that? So I'm sure that there'll be something within there that could be of interest to you, that you could have the skills for, that you literally didn't know about. So I've just pulled a few of them up here for you. So we've got allied health professionals, and they're the people who help patients to be independent and live their life as full as possible. Different types. So you may have heard of physiotherapists, occupational therapists, speech and language, radiographers. There's so many more. There's actually 16 roles. So if you're interested in the sciencey type of thing, have a look at those. The ambulance service, do I really need to explain? Yeah, they're more than flashing blue lights. They make a difference every day to patients in emergency and non-emergency situations. Then we've got dental. Okay, dental, they're a team who look after the nation's mouths, and some of the things that start in our mouth actually manifest in other areas of our body. So it's important that the dental team are there. Doctors, do I need to explain what doctors are? I don't think so. Also nurses, that hasn't been put on this slide, but nurses are very important as well. In fact, yesterday on an event, somebody asked, what's the difference between a doctor and a nurse? And the nurse actually said, the nurse boss the doctors around. So there you go. Healthcare science, these staff play a vital role in diagnosis and treatment of lots of medical conditions. And on an event I was on yesterday, what they do is they prevent, they diagnose, they monitor, and they treat. So we need those people to be helping us. Health informatics. So if you're interested in information technology, if you like IT, if you like facts, if you like analysing information, this is another area that is really, really growing. And in fact, there's going to be apprenticeship opportunities coming up in this area across our region very, very shortly. Healthcare support workers, obviously that's healthcare, patient care, speciality roles, and there's various aspects of training that you can do in healthcare support. Non-clinical is a massive, it's what they call corporate services, and what they do is they basically support all the frontline workers with everything they need. So if you think about HR, learning and development, IT, resources, finance, all those things that need to be done to keep the hospital going. Management, obviously, you know, a lot of people I speak to start off in clinical and then they go into management, whether it's out of clinical and into training, or they stay in the clinical roles and develop. Okay. NHS Values, I can't stress this enough to you, that NHS Values are the actual foundation of everything that they do. What they basically say in the NHS is that if you've got the right values, the right attitude and the right behaviours, we can give you the skills. And it's absolutely right. And look at those, there's 6 of them there. If you think about it, when you're in hospital or a family member or a friend, you'd want people to be working together for patients. You'd want to be treated with respect and dignity. You'd want somebody to be committed to make sure the quality of care that you were getting was of a great standard. You'd want people to be compassionate with you. You'd want them to help and improve your life. If there was a situation where, you know, your life had changed in the circumstances, they would help you. And the big one is everyone counts. It's a big team in the NHS. They're the 3rd largest employer in the UK. Okay, so routes in. So you might say, Sharon, okay, I'm interested now. How can I join the NHS? What sorts of things can I do? Okay, so there's employability programs, and I'm sure Thrive will be supporting you with those. There's opportunities with other organisations to work with them. Princess Trust is one of them. Also, there's work experience. There's not much of that going on at the moment because of pandemic. There has been some virtual, but that will come back into play. T-levels are something that are coming in September in health and science. So that's something to look at, and if it's their equivalent to 3 A-levels, and there's actually placement opportunities on that as well, so it's a combination of 2. Supported internships there for 16 to 24-year-olds with learning difficulties or disabilities or autism. Returning to practice, well, that'll be somebody who's already worked in the NHS and basically wants to come back, so they'll go through a retraining programme. Traineeships, well, that's an opportunity for 16 to 24-year-olds, for people who want to have some work experience in a valued environment that they're interested in, and that can last up to 6 months. Usually, a traineeship will progress into an apprenticeship, so it's like steps of a ladder. And then there's Kickstart. The JCPs and the DWP, they're running Kickstart programs, and they're running sector-based work academy programs, so you can get a flavour of what the Kickstart scheme's all about. And you know, there's a paid role there. And then obviously we're looking at apprenticeships. You'd need to be in the job to do an apprenticeship. You know, I've had experience of working with apprentices over the last 3 years, And the way people progress is absolutely amazing, and it's really rewarding for them. Okay, some little hints and tips. I'm not going to read them all, but essentially, if you're interested in any jobs in the NHS, go onto the website. There's the information there, and have a look and see what you think is of interest. You can save what you think might be of interest and come back. You can also set alerts if you want to know when certain jobs come up. But always keep an eye on the closing date, because what's happened with me is I've had the opportunities, I've circulated them out, and because they've had a massive response, they've reduced the closing date. So be aware of that. Job description and person specification are two different things. With the NHS, the application is the most important thing, and once you've done it, you can save it. The person specification is very, very key, and your support workers will work with you on that. The person specification must match the table that they send out to you. So if it's asking for communication skills, look at examples of, just don't say I'm a good communicator, because that doesn't tell us anything. I'm a good communicator because I've attended a webinar, I've asked questions, or I've run a session, or whatever you've done, or you've presented to your colleagues, whatever you've done, things in there. So think about the STAR acronym that you can use when you're looking at that. The application process is detailed, and as I said, you can save it and go back to it. If you're not successful, first of all, don't be put off. I know many people who have not got their first interview from an application, but they've gone on and they've got one after that. It's just practice, practice, practice. Okay. The other area that we're looking at is, away from the NHS, it's adult social care. This is another option for you, and what they do there is support individuals to maintain independence and dignity, and make sure they have choice and control. Okay, so what jobs are there in adult social care? Well, look again, we've got the clinical roles, the care managers, the supervisors, personal assistant, activity coordinators. They're the people who basically set up activities for people so they can, you know, be more active, whether it be physical or mental. Support workers, who obviously support people, and there's other roles there, and building up to team manager roles. And then you've got the non-clinical roles, which are management, admin, reception, accounts, domestic, catering. Just think about it, everything needs support. So it's not just care roles. If you're not somebody who wants to do a particular care role, you want to work in the environment, but in the support mechanism, then you could look at that too. Okay, what makes a good carer? Well, I'm sure you'd have a lot of suggestions for me. But essentially, just looking around this diagram here, I want you to be a good listener. So there's communication coming in again. Be observant. If something's happened or somebody's not actually communicating the way they did the day before, be observant and let people know. Problem solving. So these are all skills and attributes, that the skills you can learn, and the attributes are about you, the individual. Confidence, well, that will come the more you get into the work environment, and it will build up your profile and your experience. Okay, so how can you access into adult social care? I've told you how to access into the NHS. So look at recruitment events. There's plenty out there, whether they're virtual or when they become face-to-face. Open days, Job Centre Plus. Now I mentioned SWAPs, the sector-based work academy programmes. If you're interested, what I've been doing is bringing opportunities from providers to the JCP, and what they do is they set up what's called a SWAP, and you can attend that. It's a week, sometimes 2 weeks, and it involves a placement as well with the person with the company who's looking to recruit. So essentially, you'll have a little bit of experience, you'll get some training, you'll build up your confidence, and then there's an interview at the end. and they'll only put a swap on if there's jobs there. But at the end of the day, you'll have to go through the interview process. I mean, literally, I've been doing this since November, and already 26 people have gone into work as a result of swaps I've brought to the job centre. So they are definite vacancies. You can also apply direct to organisations, but again, think about what's relevant to them, what they're looking for, and how it would help you to get that interview. Okay. These are some useful links that I'll leave with Rich so you can have a look at. There's so much information out there. We've actually got a Youth Hub website, which is called Youth Hub Be More. And essentially what you can do, you can go on there and have a look at the NHS support and toolkits there that'll help you. And then also you've got adult social care there as well. So lots of information out there for you to have a look at. What I'm basically doing is speaking to, I've got 12 trusts in my area, so I'm speaking to the HR directors and their teams of people from recruitment and asking them to sort of give me the opportunities before they go on the website if we can, so that we can get them out to the likes of yourselves to give you a little bit of an opportunity to apply for them initially. In some cases, we're ring fencing them for people. There's a massive underrepresentation in the NHS of people from ethnic backgrounds, also young white males, and in some instances, women in higher positions. So, you know, there's quite a lot of diversity that we need to tap into as well. The NHS are definitely looking for people with the right values, the right attitude and the right behaviours. So, you know, if you are thinking of an opportunity and a career, because there are, you know, the careers paths are amazing, then it's something to think about